Here's how to spot the difference between type 1 and type 2 respiratory failure, and here are the common causes of both. Type 1 respiratory failure is when a patient has low oxygen. This is typically less than 8 kilopascals, and this typically happens when there's a VQ mismatch. So the flow of air going in and out of the lungs isn't matched up with the flow of blood that's going to the lung tissue. Common causes of type 1 respiratory failure include pulmonary edema, bronchoconstriction, and a pulmonary embolism. Type 2 respiratory failure, on the other hand, this is when you have a really high level of CO2, typically greater than 6 kilopascals, and this is typically caused by increased airway obstruction. So a classic example is COPD. Type 2 respiratory failure happens when you've got alveolar hypoventilation. This means that the alveoli aren't able to get enough oxygen and they aren't able to eliminate enough CO2. This causes the CO2 levels to build up. Common causes of type 2 respiratory failure include things like COPD, pneumonia, rib fractures, obesity, and sometimes drug-induced causes such as opiates. For more videos like this on tips to interpret ABGs, then make sure to follow Geeky Medics.